Now to Queen's Park, and the province is considering a proposal that would expand a list of minor ailments that pharmacists are allowed to prescribe treatment for. The change would expand on a list of conditions pharmacists can now assess and treat without a doctor. It's supposed to take some of the burden away from the healthcare system, but as Greg Ross explains, the proposal is getting pushback from some in the medical community.
Last year, Alexander Mihaela started assessing customers at his downtown pharmacy when they came in with minor ailments. That's when the government began allowing pharmacists to prescribe medications for things like pink eye and urinary tract infections.
It allows us to provide care that's immediate when a patient comes in and they have a minor condition.
In all, there are currently 19 minor conditions that pharmacists in Ontario can recommend prescription drugs for without the consent of a doctor. The province has a list of 14 more they would like to add, including sore throat, shingles, and lice. Mihaela says this benefits patients and the healthcare system.
The advantage is time. Instead of coming in with a problem like that we typically know, we have a cold sore. Are we going to go burden the healthcare system by waiting in the emergency room? Are we going to wait for an appointment from the doctor that's going to take 5 days, a week?
Not everyone in the medical field sees it that way.
A lot of these issues that people come in with and their symptoms are not just about the medication. They're not just about the prescription, right? They're about, is this actually serious or not?
Dr. Dominic Novak is the president of the Ontario Medical Association. He says pharmacists don't have the training to diagnose patient symptoms.
Pharmacists aren't doctors. Doctors go to school for years, for thousands of hours to be able to diagnose and treat. Pharmacy training is different.
Novak says that nearly 1 in 4 people in the province don't have a family doctor. He says the Ontario government would be better served to address that issue.
People with a family doctor end up using the emergency department less often, in hospital less often. They end up costing the healthcare system less money, making it more sustainable in the long run.
In a statement to the Canadian press, a spokesperson for the Minister of Health said they have seen success in the program, with over 1 million people getting treatment for minor ailments. Greg Ross, CBC News, Toronto.